Now it's my pleasure to go to Dr. Fish, who is CEO of Schneck Medical Center in a more rural area, just to share with us what they've been experiencing as a hospital system. Dr. Fish?
Good afternoon, Dr. Box, Dr. Weaver, Governor. As we all know, the COVID-19 crisis has caused fear, anxiety, and has stressed our entire healthcare system. Every day here at Schneck and at other hospitals, we are faced with the difficulty of maintaining our staffing levels, maintaining and expanding our capacity as our hospitalizations rise. We also deal with shortages continuing in PPE, equipment, and medications 8 months into this pandemic. With increased COVID hospitalizations of critically ill patients, here at Schneck, we've had to go on critical care diversion several times in the past month due to our ICU being full. Most recently, the past 2 days this week, we've been on diversion. We've not had that ability to accept transfers from smaller critical access hospitals in our area as we normally do. These situations present serious concerns for patient care in our area, as well as safety communities we serve. We challenge in determining where to send patients that need a higher hospitals around us and in larger metropolitan areas, Indianapolis, Louisville, are also issues and have trouble accepting our patients. On top of the extraordinary stress our healthcare providers are under, we face staffing challenges on a daily basis due to this increase. We have a number of caregivers in quarantine. Some have had to stay home with their children whose schools have transitioned to online learning. We've attempted to create what we call a clubhouse Schneck so that our staff can continue to come to work and their kids can virtually learn. So we are prepared if that. Many of our staff members have decided to leave inpatient care and to go to outpatient settings. We've seen that increase since COVID-19. And some have just overall left the profession due to being burnt out. A number of our staff as well, if not all, are just emotionally and physically exhausted and need a break. These staffing shortages are compounded by increased hospitalizations across the West. Access to supplemental staff is basically non-existent. Every day we try to attempt to hire agency nurses and they're just not available. So members of our healthcare team who hold clinical but who support important support roles such as regulatory compliance, risk and safety, information technology are now being deployed to the front lines to care for patients. And even with this deployment, the demand of patient care exceeds the staffing capacity like ours. Challenges will continue as the COVID positivity rates and hospitalizations continue. Because we've had to redeploy caregivers to inpatient and critical care units, other areas such as surgery, endoscopy, our physician practices have to delay patient care, which is never in the best interest of our patients. I'd say just imagine if your loved one had a preventative screening colonoscopy scheduled and that screening was postponed. What if your loved one had a growing tumor that could not be discovered for 2 to 3 months? Or imagine if your wife, your mother, your grandmother, or your daughter had to wait to see their physician to discuss a lump found in their breast. These challenges are real and are happening every day and can affect our ways. When you're a rural hospital, our patients are our friends, they're our neighbors, they're our loved ones. We see them at church, we see them at the grocery store and other places throughout town. And we have obligation to provide comprehensive health care close to home, which has been jeopardized by these rising hospitalizations related to COVID. Unfortunately, we don't see an end in the near future. Our PPE shortages are continuing, our staffing shortages, and rapid testing remains limited. But there is hope. There is hope with promising therapies such as monoclonal antibodies and the preventive vaccines. But what we need the community's help in stopping the spread of COVID. We're in of Jackson counties and Hoosiers across the state to trust the medical evidence and do what they can do to help slow the spread. When you're making your decisions in your everyday life, think of your healthcare team who has been battling this pandemic every day for the past 8 months. Healthcare workers, when you put on your mask, think when you decide to postpone your large gathering. Think of the residents in your communities who are at risk for serious COVID when you keep your distance from others and wash your hands. We need to trust the science. We have to stop making this public health emergency a political issue. This is not a Democrat versus Republican issue. It's a matter of care, concern, and regard for your family, your friends, and your neighbors' health and well-being. If we can all work together, we can make a difference and slow this spread. All of us at Schneck Medical Center appreciate and thank you for your continued support, Governor. We appreciate all you and your team are doing, and thank you for allowing Schneck Medical Center to share our story. And please stay safe.
Thank you, Dr. Fish. Extremely well said. We really appreciate you. And I understand you're going to hang on with us for questions in case there's any questions. It is now my pleasure to introduce Sarah Patrolski. She is Vice President of Nursing and Clinical Services at Beacon Health System. Sarah?
Thank you, and thank you for the invite. I'm excited to share a little bit of perspective from our frontline caregivers here in the north of the state. I do echo all of the sentiments Dr. Fish just shared with everyone. We feel that same pain, and I'm happy to know that we're all in it together. I'd first like to share that nurses and anyone who's dedicated themselves to a life of healthcare are risers, in that we rise to the occasion. We want the very, very best for our communities and the patients that we serve, and day in and day out and night in and night out, we are rising to the occasion on their behalf. When there's a need, we're here to fill it. We have had nursing shortages long before COVID-19, and they have stretched us thin, but this pandemic has stretched us and squeezed us in a way that we have never, ever experienced before. Like Dr. Fish shared, there are patients that unfortunately we can't meet their needs right now because we're inundated. We have an abundance of patients, more than we can quite frankly handle right now. And these patients are very, very hard to take care of. Donning and doffing is not new to healthcare. We have done PPE for a very long time, but in the mass amounts that we're doing every single day, makes it incredibly difficult to provide the care that we like to for patients. So we're doing our very best, but it is very hard. And for these patients, I hope people remember they're alone due to the much needed visitor restriction. And so we are their caregivers, we are their friends, and we are their family members. And for our frontline staff, it's very, very emotionally tough for them to be absolutely everything for absolutely everybody. And death and dying has always been part of healthcare. We've dealt with that the entire time we signed up for these careers, but death and the numbers we're seeing with COVID is not what we're used to. We're seeing death at a much higher rate than we've ever experienced before, and it is affecting every single layer of our organization. From nurses to phlebotomists to lab associates who maybe saw those patients just moments before or just even yesterday and had a conversation, and today is their last, all the way down to the security guard who has the honor of transporting them to their last destination with us, which is the morgue. We are averaging at least one death per day at Beacon Health System, and this is more than we have ever experienced or care to, quite frankly. We've taken a vow for no one to die alone. And so this means at times we're teaching family members to don and doff so they can slip into the room for a very quick minute and say goodbye. And sometimes this means that we are their family members and we are holding their hands as they pass when just moments before we tried to save them. It's very, very hard for staff. The emotional toll that this pandemic has created for everyone who works in healthcare will have a very long lasting effect. This is not normal for us. We have brought on-site counselors, crisis counselors to the facility so that they can talk with our staff in the moment and on the units where they do their work. And this is also not normal. This is very hard for people. We're working very hard across the counties here in Northern Indiana as a team to be everything the community needs from us. We are rising to the occasion, but we are no longer the front line of attack for this. We are the last line, and we need help. We need our communities to pull together. We need them to fight this fight with us. We want to be here when you need us, but we need help in order to continue to do that. We want people to be on our team, and we want people to fight this fight with us. We plead and ask that people wear the mask, wash your hands. Please only gather with your immediate family. Having Thanksgiving off from large gatherings means that perhaps you get to see people at Christmas. We need the help. We appreciate the help, and we appreciate all the support everyone sends our way.
Sarah, thank you so much for putting a face on those 5,000 Hoosiers that have lost their life to this disease. I really think that you made it much more personal, and I can't tell you how much I appreciate you sharing that. It's now my pleasure to go to Dr. Mark Luckmeyer. He is Chief Medical Officer for IU Methodist Hospital, and he is actually in our studio in person. Mark?
Thank you, Dr. Box. So as you mentioned, my name is Mark Luckmeyer. I'm the Chief Medical Officer for Methodist and University Hospitals, which is otherwise known as the Adult Academic Health Center. We have the largest hospital in Indiana, and we pride ourselves with being able to take care of the sickest of the sick. We not only serve our local community here in Indianapolis, but we also serve as a major referral center for hospitals across the state. And since the start of this pandemic, this has challenged us in ways that we could not comprehend. And we've learned a lot throughout this pandemic here. We've cared for more than 1,054 COVID-positive patients, and I could not be more proud of our team for the way that we've responded to the challenges of this pandemic. You know, our ability to care for patients has really changed since the beginning of this spring. And it seems like such a long time ago, but I'll tell you the emotions that we are going through in this next wave here have immediately come back. It took us a lot of time to go through and prepare for those emotions the first time because we didn't know what we were expecting. But now that we do, and we've seen some of the warning signs and know what the next few weeks are going to bring us, I'll tell you our healthcare providers are really feeling that stress and angst right now, and so we do need your help. But we are absolutely committed to care for the patients that need our care. We are definitely strained, and you're hearing this in all hospitals throughout the state. This is not a regional problem. This is not a city problem. This is an entire Midwest problem. And so as our hospitals fill up and we see this, a lot sicker patients here, it's really challenging us to be able to withstand and continue to provide the care that we think we are able to provide here. When we talk about capacity and we talk about our ability to care for patients, we really got to think of this in three ways. So one is, do you have the supplies that you need to take care of patients? The second is, do you have the physical space that you need to take care of these same patients? And the third and the most important one is, do you have the highly skilled care team that you need in order to do this? The first time around, we were more concerned about the supply standpoint. I can tell you, as a health system and a hospital right now, we're not as concerned with that. We've taken that time, from the first wave to really try to build our resources up. From a space standpoint, we have a big hospital. We have care spaces, and we're working on identifying some additional opportunities in those care spaces that we haven't used for a long time. That's going to still take some work, but we're actively working on that. What worries me the most in what you're hearing pretty consistently from all of us is that the health of our team members is most important. So a bed is just a bed. A room is just a room. But if you put that with highly skilled professionals, that becomes a hospital. And that's really what matters to us. And the health and safety of our team members, who are also members of our community, are really important to take care of. And as we go through this and we see the level of angst, the amount of work, and the higher level of acuity we're seeing, not only in our COVID patients, but also in patients who don't have COVID, who may have delayed care, who may have delayed care in that first wave, is really tough. And we know we're up for a challenge here in the next few weeks to few months. And we're readying ourselves to be as prepared as possible, but we do need your help because we can't keep this up for a long period of time. And as you've heard, we're all fighting and competing for the same resources from a people standpoint. All of us are looking for additional help outside our health systems to help bolster our team members who are currently in quarantine. If you look at IU Health as a system, we have around 686 team members today currently in quarantine. And when you think about the amount of employees that are at IU Health, which is about 34,000, that may not seem like a big percentage, but every person means that's in quarantine means that maybe one less patient that we're able to take care of. And so that's really important for us to try to keep our team members and patients safe. We are going to be here. We know that there are ramifications to rising COVID cases and the community spread, and we see that delayed in the increased number of hospitalizations that are required. We've more than doubled our COVID hospitalizations since the beginning of November in our Methodist hospital. We're up to 80 patients right now, 30 of which are in the ICU. And critically ill. And we expect these numbers to continue to increase as you look at that trend in the community spread. So that has us really nervous. And so we're working very hard, long hours, and really working at the edge of our emotions to be able to continue to provide that care here. I want to thank really the Department of Health in Marion County as well as the state for the partnership and the leadership that we've partnered with over the last several months as we've taken some lessons learned. We know the best practices. We know simple practices. We know how to treat these patients, but we also need to actually do that not only for ourselves but for our community here. So I'll put one final plea in that please wear a mask, please socially distance, please limit your social gatherings. It matters to us and it matters to our community. We're all in this together, and the only way that we're going to come out of this better than when we came in it is if we all do it together. There's a resiliency that you can build when you have everybody aligned and trying to do their best. And it is exhausting if we have anything less. So thank you.
Thank you, Dr. Luckmeyer. I just want to say it's those very simple mitigation procedures that can make such a difference. And thank you for your honesty and transparency and sharing.